Tasmanian mothers who've suffered from postnatal depression and a GP whose son took his own life have spoken out about the gaps in Tasmania's health system. The College of Psychiatrists says the state has less mental health services than wealthier and healthier states when it should be getting more. Here's state political reporter Rihanna Whitson.
Amelia Padgett was diagnosed with postnatal depression a year after giving birth to her daughter Margot. The Launceston mum was suicidal and needed hospital treatment.
Had this very clear and overwhelming feeling that Margot would be better off without me, that I wasn't doing a good enough job as a mum.
Even as a private patient, her options for care were limited. The state's only mother-baby unit is in a private hospital in Hobart, so Ms Padgett was instead admitted to Calvary's psychiatric ward.
It's not a specific postnatal ward, it's literally on the ward with 10 or 12 other people who've got, an array of different things going on.
What's in here?
Amelia Padgett got the help she needed at Calvary, but could only see her daughter for 15 minutes a day.
It was really hard, it was really hard, yeah.
When Kirsty Nash developed PND, she was shocked to learn there are no mother-baby unit beds in the state's public hospitals. Ms Nash was told she'd have to wait for the one bed at St Helens allocated to public patients.
No one seemed to be able to give me a straight answer of this is when you're going to get into the mother-baby unit, because there's only one public bed.
She was able to stay with her daughter on the ward, but waited 6 weeks for the bed.
That 6 weeks of waiting was the worst 6 weeks of my life. I can't describe it or compare it to anything else.
It's really a time-critical situation for mothers, and they often need that usually brief admission, the next day sort of thing.
Dr Juliet Lavers says mentally ill children and adolescents are also missing out on the care they need. Her 16-year-old son took his own life in March last year.
Liam was very unwell, he was suicidal, and there was no safe place with a supportive program for him available in Tasmania. We had to take him to Melbourne.
Tasmania has the second highest suicide rate in the country, but it doesn't have a dedicated ward for mentally ill young people. The state's Child and Adolescent Mental Health Service has a wait list and it isn't funded to do outreach. One source told the ABC the service is massively underfunded and kids are falling through the gaps. A lot of kids turn up to ED and are never seen by a mental health professional. We know the earlier they get to them, the better their chances. The state government is building a youth mental health facility in Launceston and providing extra capacity at the Royal.
I'm extremely disappointed. I'm actually very stressed about the situation because I don't think anything has changed. I don't think what they're offering is any better than what is available now, except maybe a few more beds.
We are older and more disadvantaged than the rest of the country, so we actually need more services in all areas of health, but especially mental health, including drug and alcohol, than the other states, and in fact we've got less.
There are no plans to restore the 10 acute mental health beds cut from the Royal. The state government has instead promised to open an extra 27 subacute beds in the community.
We need further community services, but that's a completely different area to having acute beds available to patients in a crisis when they are, for example, feeling suicidal.
Without more community and acute mental health services, medical staff working on the front line say scenes like this will continue. Rihanna Whitson, ABC News.
And Rihanna Whitson joins us now live. Rihanna, yesterday the government didn't specifically address concerns about the lack of GPs in Tasmania. What's it had to say about the lack of mental health services?
Today, the Health Minister's office said the government has boosted funding for mental health services. It also pointed to the 16-bed adolescent unit promised at the Royal. That's not due to open until 2020 though, and only some of the beds will be for psychiatric patients. Like in Launceston, there's no guarantee the facilities will include full-time psychiatric staff. The government didn't respond to direct questions about whether it will invest in mother-baby units in the state's public hospitals. That's prompted the opposition to accuse Michael Ferguson of not listening to Tasmanians dealing with mental health issues.
And tomorrow night, Rihanna Whitson's investigation of Tasmania's health system turns its attention to the pressure on the state's paramedics.